In this session we will be seeing most common causes. Okay, so because I don't want to waste the time in the one liners, but if you want the one liners, please comment in the section, so I'll be start preparing for that. Because there are a number of channels having what is the one liners in microbiology, and so somewhat I want to be make it an easier, so I have compiled the collection of most common causes. Okay, but if you want one liners you can comment. Okay, so that I will start preparing for that. So okay, so here the first question is the most dangerous form of diphtheria, it is an laryngeal, but the most common form of diphtheria, it is an respiratory or like laryngeal, whatever it can. Okay, so they can give the option. So next, what is the most dangerous form of anthrax? The both pulmonary and the intestinal, because it has a high fatality rate. See, the most infectious form of plague and fatal form, again it is a pneumonic, but the most common form of plague, it is a bubonic. Okay, so most common form of anthrax, it is a cutaneous. So the most infectious stage of the in pertussis, it is in catarrhal phase. Okay, common cause of the gas gangrene, it is in Clostridium perfringens type A. Okay, so what are the other agents causing gas gangrene is Clostridium novae and Clostridium septicum. And there is a famous mnemonic, PNS, peripheral nervous system. One is in perfringens, N for novae and S for septicum. See, the most common region involved in the enteritis necroticans or the gas gangrene of the bowel, it is in jejunum. Okay, so just for refreshing I'm saying, but in tuberculosis the region is an ileum, right? Whereas for what is that amoebiasis, it is an ileocecal junction. Whereas in amoebiasis caused in the liver, it is in right postero superior surface of the liver. Okay, so just for refreshment I'm saying. So coming for next question, most common source of the foodborne botulism. Yeah, it is a home canned food because it will be packed with an botulinum spores. Most common cause of nosocomial diarrhea, it is an Clostridium difficile, but most common cause of nosocomial UTI, it is an E. coli. Okay. So most common source of infection in diphtheria, yeah, it is a carrier. So friends, just for refreshment I'm saying, recall there are three carriers. Okay, important carriers you want to remember. So one, it is an what is the salmonella, second the diphtheria, third it is an Neisseria meningitis, and again it is also for Staphylococcus aureus, the nasal carriers. See, most common causative agent for actinomycosis is actinomyces israelii. Most common cause of lymphocutaneous nocardiasis, it is in Nocardia brasiliensis, but the most common form of nocardia, it is in pulmonary when compared to the lymphocutaneous form. So next question is most common cause of primary and secondary bacterial peritonitis, it is an E. coli, sorry. And so coming for the traveler's diarrhea, so here the bacterial cause, it is an enterotoxigenic Escherichia coli, whereas viral cause of traveler diarrhea, it is an rotavirus. So parasitic cause, it is an Giardia. Okay. So most common cause of pyelonephritis in the pregnant women, it is an E. coli. So friends, always remember something if related to urinary tract infection, the first option you want to get, it is an E. coli. See, most common cause of shigellosis in India, it is in Flexneri, whereas it is in world, it is in Sona. You can remember like world, O for O. Okay. But in India, there is no. A collection of tuberculosis, okay, both the tuberculosis and the leprosy. So here the first most common, the first organ to be involved in tuberculosis, it is a lung, whereas extrapulmonary tuberculosis, it is a lymph node. So among the lymph node, which is the most common lymph node, it is a posterior cervical and supraclavicular lymph node. So friends, again for lymphadenopathies, there is a small video in my channel, that is the important lymphadenopathies which is enlisted in the microbiology. Okay, so coming for the most common bone involved in tuberculosis, it is in spine, next hip, then knees. So most common site involved in gastrointestinal TB is ileocecum. So first it is in ileum, second it is in cecum. So most common region involved in the genitourinary tuberculosis, for the males it is an epididymis, and for female, as you know, it is in fallopian tube and endometrium. So this can lead to an infertility, right? So most common type of cutaneous tuberculosis is lupus vulgaris. So next it is in leprosy. The most common nerve involved in leprosy, as you know, it is an ulnar nerve, which is a typical finding. Next, the most common bacterial cause of diarrhea in developed countries, it is in Campylobacter jejuni. So most common complication of Haemophilus influenza B, it is in subdural effusion. And most common cause of community acquired pneumonia or the walking pneumonia, it is in Mycoplasma pneumonia. And why it is called as in walking pneumonia? Because the patient will be like, as though he is not having any symptoms, okay, but on clinical examination or on any investigation x-rays, you can make out some of the findings, okay. Most common cause of non-gonococcal urethritis, it is in chlamydia. So most common cause of post-gonococcal urethritis and most common cause of epididymis in male. So all the option, it is in chlamydia trachomatis, okay. So most common extrapulmonary site involved in legionellosis, it is in heart, but the most common manifestation of legionellosis, like among the CNS manifestation, is like the patient will be having an altered mental status, okay, just remember that. So coming for most common cause of vaginitis in pregnant women, yeah, it is in candidiasis. So the important point in candida, you want to remember, like it will be producing an cardioid discharge, pseudo hyphae, germ test will be positive. And most common cause of vaginitis in young female, it is in Trichomonas vaginalis. So in Trichomonas vaginalis, there is a specific term called as an so the discharge will be like somewhat greenish discharge, whereas in candida it will be like cardioid discharge. So most common cause of tubal blockage in developing countries, yeah, it is in tuberculosis. I told you already, because the most common cause of the infertility, it is in tuberculosis in India. That is because of an fallopian tube is getting involved. So most common cause of tubal blockage in developed countries, it is in chlamydia. So here the most common organism usually present in the human wounds, okay, that is mainly because of the bite of any animal like cat and the dog, it is in Pasteurella multocida, okay. So if you come across any bites, so here the final question in bacteriology is the most common gram positive organism causing meningitis, it is in pneumonia, whereas gram negative organism, it is in Neisseria meningitidis. So this completes in most common cause among the bacteriology. In next session, we will be seeing about the virology, parasitology and mycology. Okay, thank you friends.